Number 4, photobiomodulation, when light becomes medicine. What if healing chronic pain didn't require medication, injections, or surgery? What if the right wavelength of light delivered at the right frequency could fundamentally reorganize how your nervous system processes signals? This is not science fiction. It's called photobiomodulation, and it represents one of the most misunderstood and yet powerful tools in modern healing. First off, light does not heal your body. Light changes the signaling conditions within your cells, and when the signaling becomes coherent, the body begins to heal itself. The key to understanding photobiomodulation lies in recognizing the critical principle: more is not better. This follows the Arndt-Schulz law, which describes a biphasic dose-response relationship. Too little produces no effect. Optimal light stimulates positive biological response, and too much light inhibits or damages tissue. This is why low-level laser therapy can accelerate healing, while high-powered lasers can burn tissue. Power matters far less than precision. The therapeutic window is narrow, and frequency, measured in hertz, determines whether you're working within it. At the cellular level, photobiomodulation targets cytochrome C oxidase, the complex 4 of your mitochondrial electron transport chain. This enzyme is the final electron acceptor before ATP production, the energy currency your cells use for every function. When cells are stressed, injured, or inflamed, nitric oxide can bind to CCO, or cytochrome C oxidase, which blocks oxygen from completing the electron transport chain. ATP production drops, and cells will shift into survival mode, therefore stalling your healing mode. So using red light, near-infrared light, these are both absorbed by cytochrome C oxidase, and this photonic energy disrupts the nitric oxide to cytochrome C oxidase bond, allowing oxygen to bind again. Therefore, electron flow is restored, ATP production is increased, and reactive oxygen species normalize. Keep in mind, reactive oxygen species are the reason why you are being told to take antioxidants. The cell regains energy to repair, regenerate, and function properly. But the effects extend way beyond the mitochondria. When you pulse light at specific frequencies matched to natural brain wave patterns like alpha or theta, you can create resonance within the neural networks. Neurons can begin firing in synchrony, and this coherent signaling allows the brain regions to communicate far more effectively, enabling neuroplasticity, and the nervous system's ability can reorganize, relearn, and adapt. This is where photobiomodulation becomes transformative for chronic pain and postural relearning. Remember that chronic pain is often encoded in neural pathways. Your nervous system has learned to amplify threat signals even after tissue healing is completed. Photobiomodulation doesn't directly eliminate pain. Instead, it creates optimal conditions for the nervous system to rewrite those pathways. Now keep in mind, this treatment is not magic. It is strategic cellular intervention. By restoring proper ATP production and promoting neural coherence through frequency-specific pulsing, photobiomodulation opens a window. In that window, targeted movement, sensory input, and pattern disruption can recode your motor programs more effectively than through mechanical means alone. This is why photobiomodulation works best as part of an integrated approach, not as a standalone treatment. Light creates the conditions, but you still must do the work of reprogramming. Again, when signals become coherent, healing becomes possible again.